and welcome to this session on caring for the kidneys and preventing UTI. UTI is basically urinary tract infection. So we have with us Dr. Krishna Patil, who is a subject matter expert and a well-known authority in this matter. So I welcome Dr. Krishna Patil to take us through the session and educate us about how we can take care of the kidneys better and how we can keep ourselves away from any kind of infections. Good afternoon, doctor, and welcome to the session.
Good afternoon. Thank you very much. Thank you for organizing this webinar, which will be an informative session. Kidneys have long been neglected. Many a times the heart takes a precedence. It deserves that. But kidneys, we are seeing huge number of patients with kidney failure requiring dialysis, and that could have been prevented if we could have diagnosed the kidney disease in early stages. So I take this opportunity to create a little more awareness about what are the daily practices that can affect kidney function, how we can prevent kidney function from deteriorating. A typical story that we often come across in our daily medical practice is a well-educated professional getting admitted with either headache, some puffiness of face, swelling in feet, who has been previously on multiple occasions told that he has high blood pressure, but has neglected it because he did not get any symptoms. So blood pressure is such a thing that it is one of the first things to rise when the kidney function gets affected. But because it does not cause any symptoms, a busy professional is likely to neglect those hints that his kidney might be affected, and they later come up with kidney failure. So blood pressure is one of the most important signs where we are seeing 30% of Indian adult population having high blood pressure. When I screened school children in Calcutta, we found 4% of school children had hypertension. So the current lifestyle that we are leading, right from childhood, the kind of diet we are consuming, we are at high risk for getting blood pressure even from the childhood. 4% hypertension in school children is a big number. So we are actually going to see a pandemic of kidney disease in future if the things continue in the same way. Why I say it is a pandemic already, because US data suggests that 1 in 7 US adults already has a chronic kidney disease. 1 out of 5 hypertensive people, like those with high blood pressure, has chronic kidney disease. 1 out of 3 diabetic patients is likely to have a chronic kidney disease. 30% of Indian adults have diabetes, 35% of Indian adults have hypertension. So with that, the number of chronic kidney disease patients is also significantly more. In India, the screening of population from all the zones in India suggested that 17% of Indian adults have kidney disease, and 6% of them are significantly affected, like their kidney disease in the stage 3 to 5. So that is the kind of numbers of kidney disease we are seeing in Indian population. The problem with kidney disease is that people will remain unaware till very late stage. There was a study published in 2016 in a very popular medical journal called Lancet, where different populations worldwide were screened and looked into awareness of chronic kidney disease. So it was found that only 7% of CKD patients were aware that they had chronic kidney disease. So if 100 people of chronic kidney disease are there, only 7 out of them are aware that they have a kidney disease. 93 are not aware that they have kidney disease. Studies have shown in Indian scenario that 50% of kidney disease is diagnosed when the patient has already reached stage 5, that is dialysis requiring. When the kidney function drops to less than 20%, that is the time when people start to get some symptoms of kidney disease, like puffiness of face, swelling in the feet, decrease in urine, lack of appetite, or nausea, vomitings. These symptoms come quite late. So kidney disease can remain without symptoms for long. I often give an example to my patients. Like if you have a bike and you run out of petrol, what you do is you turn the knob towards reserve and you use the reserve of petrol and your bike runs as it was running before. But now it is running on a reserve. So kidneys also have a huge reserve. Each kidney has around 1 million filters. And there are 2 kidneys. Even if you donate 1 kidney to someone, still you can manage your life with 1 kidney. What does that indicate? 50% kidney function is gone, still you can manage. Your body can tolerate that. So kidney function significantly when lost, only then symptoms start. So the best thing is to screen for kidney disease, because early you detect kidney disease, the best difference you can make. You can retard the progression of kidney disease. And because there are no symptoms, the simplest tests that anyone with high risk, it's best to screen for kidney disease. And once a year screening is essential to diagnose kidney disease, because 17% of Indian adults have kidney disease. Many of our family members who are above 50 might already be having kidney disease and we might be neglecting. It's better to screen. Preventing kidney disease essentially is preventing diabetes and preventing hypertension, because these are the most important risk factors for getting a kidney disease: diabetes and hypertension. And both of these come from obesity. So preventing obesity, preventing diabetes, preventing hypertension, these are the most 3 important things to do, apart from quitting all unhealthy habits like smoking and alcohol consumption, avoiding use of painkillers on a regular basis. Many a times Ayurvedic medicines or Siddha medicines are touted as without any side effects, but mind it, those medicines which have heavy metals in them like gold, mercury, silver, we often come across patients coming with kidney failure because of consumption of Ayurvedic medicines containing heavy metals. Preventing kidney stones, preventing urinary tract infections, and yearly screening for those who are at risk. This is how you can prevent kidney disease. Now, coming to the topic today, that is urinary tract infections. Urinary tract infections are very common. 1 out of 3 females would have got at least 1 episode of urinary tract infection by the time they have reached the age of 24. That is how common urinary tract infections are, especially in females. Urinary tract infections are of 2 types: the lower tract and upper tract. So our kidney and urinary bladder, the upper tract means the kidneys and the lower tract is the bladder. So bladder infection or the kidney infection. Now there are again, it can be classified as complicated urine infections and uncomplicated urine infections. Most of the urine infections that are seen in young healthy females are uncomplicated urine infections. Whereas there are certain situations where this urine infection can become life-threatening or organ-threatening. That is called a complicated UTI, and I will be briefly touching that. What are the common symptoms? How do you identify a urine tract infection? Anyone who has got a UTI will know that they will have burning pain while urinating. That is the most common symptom. But sometimes patients don't get this typical sign of burning pain while urinating. It could be just that their frequency of urination has increased. They might wake up more than 3 times at night for urinating or go more frequently in the daytime. There could be increased urgency for urinating. There could be some pain in the lower abdomen or in the loin areas. And rarely people may come with some blood tinged urine. Sometimes fever and chills are associated. Sometimes there won't be any fever. Especially elderly people may have just altered sensorium, or their behavior may change. There may not be any other signs. So it can be very subtle, it can be very obvious. The very obvious thing is pain while urinating, but it can present in very subtle ways as well, and needs to have a suspicion when things are not improving in time. So as we already mentioned, it is very common in young females. 1 out of 3 female by the age of 24 has got at least one episode of lower tract urinary infection. It is also common in pregnancy. In India, up to 20% of pregnant ladies are documented as getting some symptomatic urinary infection or asymptomatic, just presence of bacteria in their urine. Now, upper tract infection, that is kidney infection, is a little rare. It is around 12 to 13 cases per 10,000 females. Now, what are the risk factors for urine infection? Females generally, because of a smaller urinary tract and the proximity with the anal canal, they have more likelihood of getting a urine infection. But having said that, it is also common in a list of people who are at risk for urine infection, the commonest being those who are diabetics. Because of increased increased sugar levels in their urine, that becomes a fertile ground for bacteria to grow. Diabetics may also develop nerve affection, because of which the bladder emptying is affected and predisposed to urine infection. So diabetes is one very important risk factor for getting urinary tract infections. Those who have urine infections after sexual activity, that is called postcoital urinary tract infection, that is also common. Pregnancy is a risk factor for UTI. Elderly females, because of the poor pelvic floor muscle tone due to previous deliveries, the bladder emptying is incomplete, they can be at risk. Postmenopausal females, because of change in the hormonal levels, the dryness in the vagina causes change in pH and increase microorganism growth there, leading to recurrent urine infections. Having tract anomalies, that is like having some stone in the urinary tract or enlarged prostate in elderly men. So these are some risk factors for getting urinary tract infections or complicated urinary tract infections. Now, having understood all these risk factors and the symptoms of urinary tract infection, how to prevent? Preventing urinary tract infection is very simple but often missed. Because of our busy schedules, we forget to drink enough water. The bladder is not flushed enough and the bacteria get chance to colonize and grow. So consuming enough water to at least form 1.5 to 2 liters of urine, which means around 2 to 3 liters of water intake per day. It may differ based on our age, it may differ based on our physical activity, our exposure to the externals, our sedentary versus how active we are. All these matter, but on an average, 2 to 3 liters of water intake is good for a young individual. Avoiding habitual prolonged holding of urine. Many times, because of our professional engagements, we tend to keep on holding the urine for a long time. This is a very bad habit. It can affect kidney function. It can also have increased risk for urinary tract infections. Now, preventing UTIs, what are the do's and don'ts? For females especially, habits like wiping after ablution from front to back is important. It can prevent UTIs because the most common urinary infections are because of the bacteria that grow in the gut that are there from the anal canal. So avoiding back to front wiping. So, and keeping the genital area clean and dry, drinking plenty of fluids, avoiding sugary drinks. Avoiding sugar is very important. The more the sugar in the diet, more sugary beverages you consume, the more likelihood of urinary tract infection. After and before having sex, it is essential for especially females to clean the genital areas. And after having sex, they should postcoital, they should have a habit of voiding, that is urinating, so that the bladder is flushed. And for those like the children and elderly people who need nappies or incontinence pads, promptly changing them when they are soiled. These are some do's. Don'ts: do not hold the urine for a long time. Do not rush when going for a pee. Try to fully empty the bladder. Sometimes we are in a hurry. So the bladder emptying should be ensured that it is complete. Avoid wearing tight synthetic underwears such as nylon. Do not drink alcoholic or sugary beverages. Do not use condoms or diaphragms with spermicidal lube on them. Try non-spermicidal lubes or a different type of contraception. If somebody is getting UTIs, that this could be urinary tract infection, this could be one of the reasons. So how to prevent recurrent? Sometimes there are recurrent urine infections. Sometimes people suffer with more than one episode of urinary tract infection. When do we call it a recurrent UTI? If there are 2 episodes within 6 months, or if there are 3 episodes of UTI within 1 year, it is called a recurrent UTI. That means the person has a tendency for repeated urine infections, and we need to find the underlying cause why urinary tract infection is happening. Sometimes there are relapses of urine infection. That is, you treat the UTI with an antibiotic, and within 4 weeks of completing the treatment, there is a relapse. So there could be sometimes incomplete or inadequate treatment because the bacteria are developing resistance to the antibiotics. So there could be different reasons for recurrence, and treating the underlying cause, identifying that is very essential. So sometimes people tend to take an antibiotic on their own, and they develop a habit. Whenever they start getting a UTI-like symptom, take an antibiotic, it gets suppressed. So the underlying cause is not addressed many times. So you need to meet your family physician or a nephrologist to identify why repeated urinary infections are happening and treating that underlying cause. Like for diabetics, it could be proper diabetes control that could prevent repeated urine infections. For those with enlarged prostate, they may need medication to shrink the prostate. For those having incomplete emptying of bladder, they may need medication to improve the bladder emptying. For postmenopausal females, they may need estrogen creams for application in the vagina to prevent the dryness there and change in pH and bacterial overgrowth there. So there could be different strategies used. So you need to address those underlying causes in conjunction with help of your family physician or a nephrologist. Sometimes people get urinary tract infection after having sex, and that could be prevented by using a postcoital pill, postcoital antibiotic. And some people may need chronic antibiotic prophylaxis, like for 6 months they may have to be placed on a simple basic antibiotic daily once a day. Now, how do we diagnose urine infection? When the patient comes with typical symptoms, we send the urine analysis. If there are more than 5 pus cells in the urine, we call it probably there is a urinary tract infection. Then we send a urine culture. Urine culture, if it is growing bacteria, more than 1 lakh colonies per ml, that again substantiates the diagnosis of UTI, and culture is very important. Often we miss sending a culture, or we already take an antibiotic and then give a culture. The likelihood of anything growing in the culture, the bacteria growing in that culture, will be less if you have already taken an antibiotic. So it is very essential before starting antibiotic, urine sample should be given for culture, because nowadays we are seeing so many antibiotic resistant bacteria that we may just treat with some antibiotic without knowing which bacteria is growing, which antibiotic will be appropriate for that. And the bacteria is not cleared completely, and it keeps relapsing again and again. Sometimes they don't respond and progress to a life-threatening complicated urinary tract infection if appropriate antibiotic is not given. And nowadays, with the increasing resistance to antibiotics, it is becoming more essential that people are aware that they should not be consuming antibiotics without the guidance, supervision of a physician who knows how to use them, when to use them, and most importantly, only after sending a urine sample for culture, so that at least after 3 days, when the culture report comes, you have something in hand that which bacteria is there, what antibiotic will be best to treat it. So these are some important points to keep in mind while diagnosing a urine infection or before starting an antibiotic. The third thing in diagnosis is doing an ultrasound of the abdomen to look for any underlying cause where the bladder is not emptying properly. There are multiple such reasons. So these are the three things: the complete urine examination, the urine culture, and an ultrasound. These are the three tests that a doctor will advise you if you have a urinary tract infection. And urinary tract infection, when it is uncomplicated or a simple cystitis, it is a straightforward 5 days course of an antibiotic. And if it gets complicated, then a 2 weeks prolonged course in which it may cause injury to the kidneys, causing rise in creatinine. It may become life-threatening sepsis. So a urinary tract infection, although it is simple, but those with risk like diabetes, immunosuppressed, their urine bladder is not emptying properly, or they have kidney stones, such people might progress to life-threatening situation called complicated UTI. So UTI should not be neglected. It should be addressed in time, especially for those who are at risk. Thank you. Thank you for the patient hearing. I'm now available for any questions, any doubts you have. Feel free to ask. Thank you.
Any questions related to kidney issues or any doubts can be asked to the doctor. He is available for answering.
Hello, doctor. This is Dheeraj. Actually, I don't have as such any problem. Even I didn't feel anything like that. But sometimes it happens like I feel like urinating, and when I go there, nothing, just
Right.
And I return back. It seems like that I should go, but nothing is there. I don't know why it happens.
Yeah. So see, these are bladder symptoms. This is called hesitancy. Like, what is your age?
37.
Do you have any diabetes or hypertension or any past history of urine infections?
No.
No. Okay. See, bladder, when it is irritated inside, the mucosa is inflamed. It causes these symptoms like overactive bladder. Small amount of urine dribbles into the bladder gets a little irritated, and it gives a sensation of need to pass. But because the bladder is not yet full, you don't have anything there much. But the mucosa inside is inflamed or slightly swollen. It is, if this is a frequent issue, you feel it that it is bothersome, it's worth doing an ultrasound. Especially the ultrasound should be like with a full bladder. You should drink at least 1 liter or 2 liters of water, and when you have a full bladder, that is, you have a good urge to void, with ultrasound we should calculate how much urine is there in your bladder, and then after passing urine, how much is staying back in the bladder. The bladder can be assessed nicely with an ultrasound. We should also do one urine analysis to look at whether there are increased pus cells. Sometimes urine tract infection can remain subclinical, like it is not overt. Your body immune system is handling it. It is not allowing it to grow much, but it is not getting cleared as well. So there can be urine infection there causing irritation of the bladder mucosa. It is not getting cleared with your immune system itself. Whereas, but it is not manifesting as urine tract infection because your body immune system is kind of keeping it under check. So not completely cleared, not completely overtaking. So such things can be diagnosed with doing a simple urine analysis, looking at the pus cells and an ultrasound. I would recommend if this is a frequent bothering symptom, you better get a urine analysis and ultrasound.
Yeah. Thank you for the information.
Doctor, can you throw some more light on the kidney stones issues, which is very common?
Yes. So kidney stones are very common, and those who get a kidney stone, they are like a very high risk for getting repeated kidney stones. At least 50% of them will develop a kidney stone within next 5 years. So especially this area, Hyderabad and this Telangana belt, because of the heat, the hot weather, and the kind of diet, the high animal protein, high salt, these are the most important risk factors, dietary risk factors for forming stones. The second thing is inadequate water intake. To prevent kidney stones, what simple advice we need to follow is at least 2 liters of urine per day. The nighttime water consumption, for those who are getting kidney stones, they should drink water even while going to bed, water enough to wake them up at least once at night to urinate, because that is those 8 to 10 hours of sleep, that is the time when the urine becomes most concentrated. So making the urine a little more dilute will prevent super concentration of the urine and stone formation. So water consumption 2 to 3 liters. Low salt diet. There are myths that those who are having kidney stones should avoid milk or calcium containing foodstuffs. That is a myth. It is not the dietary calcium that causes increased urine calcium. It is the dietary sodium. The more the sodium or salt in your diet, the more the excretion of calcium in the urine. So commonest stones are calcium stones, calcium oxalate stones, and oxalate rich foodstuffs like those who are getting repeated stones, they should avoid high oxalate foods like the spinach, tomatoes, beer. There is a myth that beer will dilute the urine and there will be increased urinary frequency, so it might be preventing stones. But beer is rich in oxalate, so calcium oxalate stones will increase for those taking beer. Or the black tea. Many a times people think that they should avoid milk and they don't put milk in their tea and they take black tea. In fact, that increases the risk for stone formation, because black tea is rich in oxalate. If you add milk to it, the calcium in the milk will bind to that oxalate and becomes an unabsorbable compound and gets excreted in the feces. But when you don't add milk to the tea, that black tea is rich in oxalate, which gets easily absorbed and appears in the urine, and there it combines with the calcium and forms the calcium oxalate stone. So there are certain myths that should be avoided. There is no need to stop milk or milk products. Important is to reduce salt intake. That will reduce the urinary calcium. The third important instruction is to reduce animal protein intake. Again, higher the animal protein intake, the more the chances of kidney stone formation. So these are some basic dietary restrictions that we advise for preventing kidney stone. And still, if somebody is getting kidney stones, we do a 24-hour urinary analysis, looking at what is the composition of the urine, because of which there is a higher tendency, and then we correct them with medication. Messages.
Yeah. So, friends, any more questions? Anyone? Fine. Thank you so much, doctor. It was very informative. It was to the point and very clear. Thank you so much for educating us on the kidney issues. Thank you.